aware that we're going to be recording this session. Okay, so Angela, how can dentists assure patients that their clinic is safe to receive care with what's going on with COVID?
Well, there's a lot of new guidelines that have come out that dentists need to be communicating to their patients. I know for the last 9 weeks, everyone kind of hid their head in the sand and they were thinking, you know what, maybe I don't have to address this yet because I don't know what's happening. But for a lot of patients, they've actually started to be gravitating towards the people who are keeping patients informed. And if their dentist seems a little bit cavalier about it, I've heard of patients actually switching dentists to the ones who seem more like they're on top of the new protocols. And, you know, there's different ways we can be approaching this, and our Alberta Dental Association and College has given us some extremely clear guidelines on what we need to be doing. And if we are, again, very clear with our patients before they arrive at the practice, they know what to expect, because we're looking like we're in hazmat suits and looking a little bit unapproachable compared to what they're used to seeing our team members like. And so if we can prepare them through our social media, let them see the visuals of what's going to be happening, let them know through newsletters and emails when they book that appointment, so they have a clear expectation of what's going to happen when they walk in, then it makes it easier for patients to come in with less anxiety, and they're going to feel like they're safe in the environment, because that's one of the biggest concerns. You know, patients have never been so aware of how close we are to their face, about spit coming out of their mouth. And, you know, every patient has laid back in the chair and had their own spit hit their face when they're having a procedure. And for them now, that feeling is going to be very anxiety provoking. And so we need to make sure that we're really taking care of that situation, reducing aerosols, making sure that we are very clear with our patients on that.
Wow. Yeah. I was going to say, I hadn't even thought about even just how much anxiety that would come out of this, but you're right. Like, that's a huge part of it. Yeah. Naheed, going along that same line, what type of technology can we utilize to turn around and support what's going on in the dental office? Because there's going to be concerns around that too, aren't there?
So as far as technologies are concerned, I mean, first thing is you know, our technicians are trained to work in dental clinics and medical clinics. So they're taking all the necessary precautions, as well as making sure that when they arrive and leave the clinics, they're sanitizing themselves, they're equipped with PPE equipment, as well as how they interact with the staff, and how they're navigating through the clinics as well, to make sure that they're not coming in the way of patients' care or areas in operatories where the issues are. So we're trying to work around that as well, where, you know, if it is absolutely necessary, that's when they're visiting the site, or they're doing a lot of work after hours to make sure that they're not interfering with the practice on a normal day. If they absolutely have to be there, then they are taking all the necessary precautions, you know, sanitizing themselves before and after entering the clinics and the operatories. So they are pretty much briefed on this almost on a weekly basis, and they are comfortable in handling those kind of situations.
Beautiful. So how can dentists make their practices profitable during a period of time that practice is quite unusual? Angela?
So profitability right now, I think, is something that is on everybody's mind. And honestly, right now, just trying to meet expenses is the first step. So dentists need to be looking at things very critically, even though they have an emotional attachment to certain things in their office and potentially certain employees. They need to be looking at their bottom line and going, okay, what do we actually need right now? And go kind of bare bones, so that those costs are really brought down, so that we aren't sinking ourselves further into further and further debt, because 2 months of shutdown is a big deal when you have continuous overhead running. And they've done things to try and reduce that overhead, but there's still been, most of the people I talk to are way behind where they were before COVID started, just because the costs have kept accumulating. So they really need to think about the long term. Like right now, it's uncomfortable to make these cutbacks and make these decisions about who they're bringing back and who they're not. They need to look at how they can be as efficient as possible in the practice. And, you know, there's increased cost due to PPE, there's increased cost due to all these different pieces of equipment that we're actually bringing into the practice as well to try and meet aerosol reducing protocols. We've got all these barriers and whatnot. So the more you can think from an outside perspective looking in, like if you had a business coach like me come in and look and I would like cut this and this and this, can you do that for yourself and make that assessment of what is absolutely necessary right now and what is a luxury that we're used to having, but we don't actually need right in the moment.
Okay, makes sense. So Naheed, going on to that, what technology would help them when they're wanting to grow their practice or even keep their practice going right now?
So great point, Dr. Mulrooney. You know, staff are at a premium right now because a lot of clinics have significantly reduced their staff and are looking at using technology to either supplement that or make their clinics and their practices more efficient with the staff that they have and the demand that's going to come up with patients that they've been offered for the last couple of months. So we're looking at a lot of technologies. Like Rafiki is a company that's not an IT company, but it's a company that supports and implements new applications, new technologies in all businesses, small to medium-sized businesses. In terms of some of the technologies that we have looked at, Microsoft 365 and Teams that can help clinics collaborate more with staff and dentists and integrate some of the existing applications, including the practice management software that they have, as well as email, as well as web communication tools so that they can track their inbound, outbound leads. They can collaborate with their CRM tools that they're using. So Microsoft 365 is an excellent tool that we recommend as one of the tools that they can use to streamline as well as make their practices more efficient. There's also things like voice technologies that can be integrated with Microsoft 365, as well as data security and data encryption, which is an area where a lot of clinics, they are still in that phase where they're not encrypting their data. So and the email communication between patients. So we feel that this tool is very effective, very powerful tool that can help clinics collaborate, as it's one software that can do a lot of things. There's also a lot of clinics still use voice communication, which can also be tied into this application, into Microsoft Teams, and it can be customized so that all information is tracked in one location, and they're able to transfer that or communicate that with the practice management software. And there's also other customized tools that we can recommend depending on the type of clinic, depending on the number of doctors they have, depending on the number of staff, admin staff that they have. Even it supports remote work. I mean, in a lot of cases, we see that there is clinics that have multiple locations and they have one call center type environment where they are the admin or the staff are working from home. So we're able to implement that as well, taking into account the security and the communication of that information that they're exchanging between remote users and the clinic to make sure that that information stays secure, it stays in one location, as well as in case if those remote workers are infected or have some kind of a virus or things like that affect their environment, they're able to revoke that very easily. So we, depending again on the size of the clinic, we feel that there's quite a few tools that we can recommend that can help the dental clinics move forward in this difficult time.
What about touchless technologies? Because everyone is very concerned about interacting with a surface and it getting interacted with someone else, so there's potential to pass on the virus that way. Are you offering some of those touchless technologies as well to integrate into the practice?
Absolutely. So we are working with a few Internet of Things companies right now, so IoT in short, where it has the ability to offer integration between the software that the clinics are using and the touchless technologies, as well as the voice activated technologies. Again, it's in the infancy stage, but there's quite a few integrations that are already built into it. So we feel that those technologies are just going to evolve, that we can assist with clinics to be able to use those and capture that information. And be able to integrate, again, based on my previous comment, to 365, so that all information is tied into one location, whether it's speech related technology, or if it is touchless, or if it is also voice activated. So it depends on that, and all information is collaboratively stored in one location.
Can I ask another question?
Sure.
With the different technologies and the apps that we can be bringing in, are they restricted based on practice management softwares? Because a lot of times there's apps that come out and they're like, I only play well with this and this and this practice management software, and then the other ones are not included in their list. Yeah. Is there that kind of restriction with what you're talking about as well?
There is restriction because, as you know, Dr. Mulrooney, in the dental world, there's still a lot of practice management software out there that is fairly outdated or fairly dated, because there hasn't been a lot of R&D done on this, and the software has not kept up to the new standards or the new integrations of the new technologies that are coming out there. However, that's still work in progress, but those are smaller size practice management vendors. But there's some of them, they're fairly large ones. They're always updating themselves. They're always integrating themselves with new technologies like digital X-rays. There's also software out there for clinical management, for clinical storage of data. So it does, those software or those clinical management systems, or I should say the practice management systems, have evolved quite a bit and do communicate with third-party software. On the other hand, there's companies like Microsoft, there's companies like Google and Amazon that have created a workspace, or what we call in technical terms, a sandbox of the environment where the application can be simply ported in there and the application would work. So having said that, there's a lot of options available out there where some of those systems are closed-ended systems, so they do not interact with outside software. Some of the newer ones that do interact, they do offer what is called an API, or the integrations that would be beneficial and also work with third-party systems.
Those are great questions, Dr. Mulrooney. Thank you. No, they're great questions. So, Dr. Mulrooney, what type of things, processes, tools, technology, ideas, do you think a dental practice needs to do or utilize to be successful and make it through the COVID pandemic?
Well, I think first they need to take a look at what they're actually doing in their practice. You know, most practices that I talk to don't have systems in place to begin with, right? And as we're moving into a new phase where our protocols, how we have to interact with patients, are changing, and again, we're dealing with patients who have a higher level of anxiety, it is good to start standardizing things across the board. And what a great opportunity to do this, because we have a little bit of extra time on our hands, so we might as well put it to good use. But we want to make sure that from start to finish, if one team member is handling someone and then the patient comes in the next time and another team member handles them, things need to be done exactly the same. Because then the patient doesn't have in the back of their mind a question mark whether this person was doing it right or this person was doing it right. So as we move through these protocols, they have to be practiced as well. You know, we have to practice how we're bringing the patients in to the practice and transferring them from one team member to the other, so that we are a well-orchestrated machine. We want to be graceful in front of the patients, not nervous about how we're doing it or feeling a little bit awkward about it, because the minute we get awkward, the poor patients are going to be feeling that, and they're going to get more anxious as well. And so the more organized, the more systematic we can be, the more we can be having these consistent and positive experiences, the better off. But it does take practice, and again, it's a great opportunity to start leveling up how we work with our teams, how we work with our patients, so that we can create that amazing experience every time that before we were just too busy to work on.
I was going to say, I heard even some of the restaurants were actually doing dry runs of walking through how to bring someone into the restaurant and do it safely. So documenting best practices, embracing the fact that there has to be a change, and the way we're going to be going forward is going to be different. But if you embrace it and do it, then the practice should be successful. I mean, there's going to be glitches, but I think recognizing that too is also probably part of this. But we're not going to go back. So therefore, it's time to start putting these best practices and processes in place, is what you're saying, right?
Yeah, and it is an upfront investment of time and, you know, time away from the patients to actually get this organized. But in the long run, this is one of the best investments you can make in your practice, because say Sally gets sick, gets hit by a bus, can't come because her kids are sick and we can't get a babysitter for them. You know, if you have to have someone else step into the practice, if you have those systems already laid out, someone can step in and quite easily learn how you run things in your practice, and they can step in and be a flawless part of your team instead of coming in and stumbling, and then patients really notice that something has shifted because their regular person isn't there and this person doesn't seem to know quite as much about what they're doing.
Interesting. Good point. So Naheed, flipping that, how can dental clinics streamline their operational processes so that they also meet all these requirements?
So, I mean, there's quite a few different ways that we can help dental clinics with their process updates. As Dr. Mulrooney just said, that we'll be too busy looking at our processes, but I think it's a great time right now to evaluate those. And some of the things that we have looked at Rafiki are offer like check-in, online check-in type communication tools. Because we all know that COVID has changed the way we operate. So things like, do we really want patients to wait in the waiting room? Or do we offer them communication tools or texting tools where they check in for their appointments, they wait for the specialist or the doctor or the hygienist for the treatment, and then maybe wait in the car or maybe show up maybe a minute before their scheduled appointment. So having said that, there's lots of tools and technologies, including analyzing the behavior of the patients and their treatments, as well as how often are they coming in to see a dentist. So there's, you know, artificial intelligence, machine learning type languages where those tools will become way more important, so that anybody can fill into those roles. By the same time, we are analyzing the patient behavior as well as their symptoms, as well as their visits to the dentist. So if they're visiting for just a toothache that maybe shows up on the bottom right side, maybe we can even get more granular to come up with names or the numbers of those tooth or teeth, depending on the requirement of the teeth of the treatment. That gets recorded based on their behavior, based on the artificial intelligence into the clinical charts, and then that can be analyzed, right? So maybe in the future that they may not even have to come and see the dentist. Maybe diagnosis can be done online based on the type of appointments they're making. So things like that, the tools that we can offer, so they will streamline the entire process of dental medical side of things, and also the follow-ups. And that can be carried over to the next step as well, where now you can start interfacing with pharmaceutical companies or pharmacies or some external clinics as well. So let's say braces or denture clinics, things like that, right? So that can be extended out, and the scope of the entire visit or the treatment can continue expanding to other third-party companies, so that not only the records are synced and correlated, but at the same time, the patient or the customer experience always continues to improve. So that, you know, a lot of times, even if they don't have to see a dentist and it becomes an issue or a treatment for a denture clinic or a braces clinic. They're able to identify that based on a few questions that they can fill out, and it can almost suggest the plan to follow, and the patients can follow that, and the dentist still is aware that what the patient is going through and what they've been doing. So I think that entire process is changing and is going to change in our what is called a new normal in dental space.
Yeah, and it's amazing. I had a technology demo this week on a scanning technology where it'll point out where it's seeing inflammation, calculus. It will show misalignments and everything. So there's amazing things that are coming out that are going to help to increase teledentistry and be able to do that pre-screening before a patient arrives at the practice, which will save some of our steps with them coming to the practice. And our time is at a premium right now because there's only so many patients that a clinic can see in a day. And if we can be leveraging these amazing technologies to help save us time and see things before they arrive at the practice, it's going to be a really smart thing for a lot of dentists to be actually looking to integrate. And before it seemed like such a sci-fi thing, it was something that we're never going to do that in dentistry. We need them in our chair and we need to look at them. Yeah. But technology is proving a lot of people wrong, which is great.
Absolutely. And the artificial, the AR, augmented reality, is going to even enhance that, to feel that you're actually in the dental office. You don't even have to leave your house to get that feeling, right? And on the other end, you can implement the augmented reality in the dental clinic to actually see that you're not in a dental clinic, to give you that experience that you're sitting like Brenda is in a mountain somewhere, right? To show you that 3D or 4D type experience, including the senses eventually, right? So I think that's going to be a great innovation that we're all looking forward to, at least in the tech world.
I was going to say that just breaks down the walls of that your clinic only services a certain geographic area to them.
Yeah.
It actually expands your area. That's very cool.
Absolutely. And can you imagine having the resources of specialists where before you could not get an appointment for months on end because you had a certain condition or wanted to see a specialist? Now, if they're available like worldwide, like, and I'm being maybe too opportunistic here or too optimistic, but even if you have a pool of doctors Canada-wide that can maybe look at the charts or the calendar and say, oh, I've got this half an hour slot that I can maybe take a patient from Alberta if they're located in Toronto or wherever, right? So I think that's going to be huge.
I was going to say, I think rural, if you start looking at the rural areas, at least that would certainly turn around and help those areas a little bit quicker and faster. And that would probably be more in the immediate future too, right?
Mm-hmm. One of my orthodontists is actually implementing that scanning technology because he lives on the outskirts, or his practice is near the outskirts of Edmonton. So he draws from about a 3-hour radius. So for his patients, if he can be seeing, is it time for them to actually come back, or things maybe haven't moved enough, then he can save them a trip in and just keep them on waiting to come back in until the scan actually shows that they're ready to come in. So it is, it is here and now. This isn't a futuristic thing anymore.
Absolutely.
That's impressive.
The future is here.
Very cool. And I was going to say, COVID's probably pushing along just really fast too. I think everybody is saying in the technology space, we just did a 5-year jump really quickly. Yeah. So Dr. Mulrooney, what are we supposed to be saying in the social media world to let the rest of us out there who are not just know what's going on? How do you change your messaging?
Well, I think just being transparent about what is happening, what you're doing in your practice to be ready for patients, but also not just having everything around COVID. People are kind of full when it comes to the topic. So you still have to address it, but then you can still be talking about opportunities for them to look at different treatments. You can still be showing your before and afters. You can be talking more about what you're passionate about in dentistry, while still keeping the COVID stuff in mind and making sure that people are aware that you are at the standard or above, and people are looking for above right now. help to keep people engaged, because if you just go all one direction, all COVID, or if you completely ignore COVID and just go with the opportunities for patients to access treatment, it's not going to go well if you go one direction only. So you want to have a mix of those two things so that you can keep people engaged and inspired about, you know, when things are good and you can afford to get that kind of smile that you want, it is going to be available to you. It's not something that we've eliminated from our offerings.
How important is it to be visible on social media right now, especially over the last few weeks and going now? Yeah.
The ones who are adding knowledge and, you know, letting people know what's actually going on, they're going to be the clinics that have patients return to them faster. I talk to probably 20 new people a week, and from different industries. Sometimes they're dentists, sometimes they're not. And the ones who aren't dentists, they've complained to me that, you know, I have no idea what's going on with the practice that I go to. And I'm nervous about going back because I have no idea if they've actually implemented things. And so if you have patients having that question in the back of their mind, they're going to be seeking out a practice that is talking about it. And social media is where a lot of people are going to be seeking that information more than your website. They want to see on a daily basis what the update is and how you're interacting with it. And social media is a beautiful dynamic platform to showcase who you are, what you do, what you're passionate about, and keeping up with exactly what's happening on a day-to-day basis.
Very cool. Interesting.
Right.
So Naheed, how should dentists be changing their approach to interacting with their patients through this time, but utilizing technology to support it?
So a lot of communication medium that way. I mean, there's things like online or on-site kiosks, for example, for check-in, which again can be the technology in kiosk base has changed significantly, that we can also look at for dental clinic, depending again on the type of clinic, the number of doctors, number of operatories that we can recommend. The screens are self-clean, self-sanitizing as well after every check-in. So that technology, I was just part of a presentation that technology is already here as far as a screen, so you don't have to clean the screen. It's got this ultraviolet type light that cleans the screen after every check-in process. So there's also online check-in, and there's also text-based or text messaging, as well as phone communication, where they can check in with their mobile devices and have that interactive communication with the clinic, whether it comes down to checking in for their appointments or rescheduling or checking their schedule online, or even making changes to any of that. You know, it's something that can be looked at for sure. And you know, people are getting away from that face-to-face interaction with the clinic as well, or even showing up at the site or talking to the front desk. That may become and I'm being very optimistic here, is that it's going to become the times of the past, because as soon as you arrive, you pretty much know which operatory you're going to, and the doctor or the specialist is ready for you. You basically get your treatment done and you leave, including payments, where it can be done online, where you receive a link as soon as you are done your appointment. You get a link and you just simply click on that link. It pays by Apple Pay or any of the credit cards that are stored in your mobile device wallet, or you can even input it. So they don't even have to touch the credit debit card, the traditional debit card machine. So those limits have also increased significantly now, where you're able to have the tokenized payment processing of over $100 as well. So provided that it's done from a trusted device. So again, security is of prime, and those technologies already exist. Rafiki also deals with a lot of payment processors and credit card companies out there, or payment companies out there, that have this solution that we can integrate that for your practice as well. So there's lots of technologies that we can enable that will minimize or eliminate that interaction with the clinic directly.
Beautiful. So I was going to say, I'm just going to open it up to our attendees. Do you have any questions for Dr. Mulrooney or Naheed? And you can pop on the chat and just pop them up. Also probably unmute everybody.
This is always the awkward part because you don't know if they're typing or they're not.
Yeah, exactly. I'm unmuting people so they can actually talk. There we go. So do we have videos to help anxious patients attend?
Yeah, and I think it's a good idea if you have like a video of how walking through the process of what patients can expect. That actually allays a lot of fears because then they've already got in their mind what it's going to be like once they're at the practice, and that's something that can be sent once an appointment is booked. It can be put out on social media in little chunks to keep people entertained as to what's going to happen. But I think the videos are a great way to really communicate with people in a way that they understand instead of just, you know, you send them a list of protocols, most people, it's going to go right over their head. But when they can actually see it in action, they can really grasp how that would actually help them. So yeah, that is a great idea, Jean.
Yeah.
Excellent. Any other questions? So while we're waiting to see if anyone else is typing, I was going to say we have a couple more Evolution Series events coming up. So on June 4th, we have Jan Eden talking with Naheed on strategies to help CEOs and their executive team build 21st century companies. And then on June 16th, we have Jan Eden speaking on privacy and security measures for the healthcare industry. So when we send out a follow-up tomorrow to all of you, you will see links to these events that you can register to. Any other questions before we do closing remarks?
I think we need to suggest to Zoom that they put a ... when people are writing so that
I know.
Yeah.
I know, because I feel like I'm cutting someone off here. So, Dr. Mulrooney, do you have any closing statement before we turn around and end this meeting?
My best advice, honestly, for dentists is to take a leadership role in this. Don't wait for the protocols to be handed out before you start doing something. Obviously, you need to be waiting for the protocols to tell you exactly what to do, but you can be planning for how things are changing by keeping an eye on what's going on. Attend webinars, get that information so that you are prepared and you can get your team prepared for what you think may be coming. And again, taking that leadership role with your patients and with your social media and not hiding from what's happening. The pandemic is here. We need to deal with it. We're trying to get back to work. And, you know, the better you purvey knowledge to the community of your patients and the general public, the better off you're going to be because you're actually leading the charge at the front instead of waiting for someone else to do it. And then that makes you, it puts you in a way more trustworthy position.
Beautiful. Naheed?
Well, overall, I think the dentists have to look at every aspect of their operations from Dr. Mulrooney, as she said, is from the web side of things, social media side of things, to technology and how it can embrace and help the clinics to streamline their operations, to grow from the ideas and the technologies that are available out there. And they will assist, they will also make their patients feel comfortable and to come back. So having said that, you know, if you show them that the type of technologies you are using and how it's safe and it's going to protect the patients as well as it's going to streamline the processes, they'll feel more comfortable and they'll come back and it'll be even more efficient to run in this time as well as for the future, where their bottom line hopefully will increase and with embracing these technologies and will grow even further. So that's what my suggestion, recommendation is.
Agreed.
Well, thank you.
Thank you.